Good morning. We're glad that you could join us today for the latest in the construction risk series, the 30-minute webinar program that we're putting on here at Kenny and Sam's on the third Thursday of every month. Today, our topic is CDC guidance and best practices for employers to consider moving forward in light of COVID-19. Please mark your calendars for the third Thursday in August, which is the 19th, when our next seminar will discuss residential construction risks. My name is Laura Rasty. I'm here with my colleague Julianne Fitzpatrick, and we're happy to be presenting to you this morning on a topic that we hope is going to prove valuable to you as a construction company with employees, but also a topic that has wider application to any employer in these times of the pandemic. We're going to start by covering some of the guidance from federal agencies on what employers should be doing with regard to employees and COVID risk, and then we're going to move on to some best practices. Before we begin, I want to caution everyone that, as you know, the COVID-19 situation, it is and has been very fluid. Guidance changes from month to month, from day to day. It's still evolving due to vaccination rates and the Delta variant that is becoming more prevalent. So what we're going to be talking about today is current guidance. This may not be the guidance in effect tomorrow. It may not be the guidance in effect next week. So please be aware of that when you're listening and applying this to your workplaces. And I'm now going to turn it over to, before I do that, and you please, if you have any questions, please put them in the chat. We'll endeavor to answer as many of them as we can, either during the program or at the conclusion of the program. And with that, I'm going to turn it over to Julianne, who is going to talk about the latest from the CDC.
Thank you, Laura. Good morning, everyone. The CDC has been one of the leading authorities for guidance throughout the COVID-19 pandemic. And just as a refresher, the CDC stands for the Centers of Disease Control. It's a part of our federal government underneath the Department of Health and Human Services, and they are the leader in disease surveillance and public health. Their mission is 24/7 to protect America from health, safety, and security threats both at home and abroad. Their guidance has been changing rapidly at each stage throughout the COVID-19 pandemic, but the current guidance as we sit here today is that for fully vaccinated individuals, there is no longer a mask mandate, they are no longer required to socially distance, and they are no longer required to quarantine. Now, it's important to understand how the CDC defines fully vaccinated. That means you are 2 weeks out from your final dose of the vaccine, whether it was a single dose or a 2-dose vaccine. If you either have not received any type of vaccine or you're not outside of that 2-week period, you are not considered fully vaccinated, and therefore the former recommendations of wearing masks and socially distancing still apply. The CDC still encourages all symptomatic employees, whether vaccinated or not vaccinated, to isolate if they are symptomatic. And now I'm going to hand it back to, before I do, one thing to be aware of, so that the CDC really has lifted the most stringent restrictions it has and guidance it has offered throughout the pandemic. However, employers should be aware that they can have more strict guidelines and requirements in their own workplaces. That is still an employer's prerogative. And so that is something that you will need to decide as employers whether that's something you want to do. And for more guidance in that area, I'm going to turn it back to Laura, who's going to discuss the EEOC guidance.
Thanks, Julianne. And just one sort of little add-on before I get to the EEOC guidance is that a lot of local governments now are actually not going back to requirements, but going back to advisories about masks and social distancing. I think it was just recently that Provincetown on Cape Cod, which has had some breakthrough infections, has instituted a mask wearing advisory, as has Nantucket. As the Delta variant spreads, and we'll have to see what happens and where it happens, but you should be aware that those advisories might come up in your localities. Turning to the EEOC guidance, the EEOC stands for the Equal Employment Opportunity Commission. It is part of the Department of Labor, and it is charged with enforcing federal anti-discrimination laws. Those include Title VII, the Age Discrimination in Employment Act, and the Americans with Disabilities Act, or the ADA for short. And it's the ADA that gives the EEOC the hook to sort of opine on what employers should do, and issue guidance and advisories with what employers should do with regard to COVID, and specifically today with regard to vaccinations, because vaccinations, your vaccination status is considered a medical issue. So employers asking about it is a medical inquiry, and therefore we're covered by the ADA. Employers can require vaccination. That's a question that we get a lot. You can do it. Later on, we're going to talk about whether you should do it, but we're going to start with that you can. This, however, is subject to two very important exceptions. Number one, if you have an employee who has a disability that is unable to get the vaccination. Number two, if you have an employee that cannot get the vaccination due to a sincerely held religious belief. In those circumstances, if you have an employee that says that they cannot get the vaccination for one of those two reasons, you need to engage in what is called the interactive process, which is essentially a fancy term for having a conversation with your employee about what the issue is, why they can't get the vaccination, and to see what you can do to accommodate that in the workplace. It might require instituting a social distancing protocol for that employee. It might require having people wear masks around that employee. There are any number of potential accommodations for that. It's important, however, to understand the difference between a political or philosophical opposition to getting the vaccine and a sincerely held religious belief. Those are different things. You need to accommodate a religious belief, a sincerely held religious belief. You do not need to accommodate somebody's political or philosophical position with regard to the vaccine. That means that if somebody is concerned that they will get COVID from the vaccine, that's not a religious belief that doesn't need to be accommodated. There's a theory going around that Bill Gates is putting microchips in people's arms via the vaccine. If you have an employee that subscribes to that theory, that is not a sincerely held religious belief. That is a political or philosophical position. That leads us to the question of what is a sincerely held religious belief. The threshold on that is very low. So if an employee tells you that they have a sincerely held religious belief that prevents them from getting the vaccine, you should assume that that is in fact the case. Even if you have never heard of the religion, even if it is not a mainstream religion, there can be under these laws a religion of one. So you should be aware of that when an employee brings that to your attention with regard to getting the vaccine. Moving on to whether employers can ask for proof of the vaccine, you absolutely can do that. You can rely on the honor system for that, or you can ask employees to prove their vaccination status either by showing you their vaccination card, or some employers are having employees execute a declaration or an affirmation stating that they are vaccinated. We advise that that's probably the best course of action to get proof rather than rely on the honor system. But you, of course, as the employer, need to engage in your own consideration of the pros and cons of doing that. You should also bear in mind that a person's vaccination status, that is whether they're vaccinated or not, is protected medical information. Again, If they got the vaccine, it's protected. If they didn't get the vaccine, it's protected. And later on in the program, Julianne is going to discuss a little bit more about what you should do in light of the fact that that information is confidential medical information. Finally, once you have asked an employee if they're vaccinated and you get a yes or no answer, our strong advice is to not follow that up with additional questions because you are in grave danger of wandering into a protected area. For example, if someone tells you that they did not get vaccinated and you ask them why, they might be disclosing a medical condition that you otherwise would not have known of, that you have no reason to know of, and that could be problematic. In addition, if you ask somebody why they didn't get vaccinated, did you have COVID before? That again is a medical inquiry that again can lead to divulging of information that you shouldn't and probably don't want to have. Similarly, do you have the antibodies? That is probably more clearly a medical inquiry that should not be engaged in. With that, that is sort of the latest and greatest from the Equal Employment Opportunity Commission. I'm going to hand it over to Julianne, who is going to talk about OSHA.
Thank you, Laura. So OSHA, as many of you may be familiar, is the Occupational Safety and Health Administration. They are again part of our federal government. They fall under the Department of Labor, and they're tasked with protecting employees and workers. That is their primary goal. They were created in 1970 with the mission of ensuring a safe and healthful working conditions for workers by setting and enforcing standards and by providing training, outreach, education, and assistance. So OSHA's guidance is going to be employee focused. It's worth noting that Massachusetts does not have its own version at the state level of OSHA. Some states do. For example, I believe California does, and they have their own separate state-specific OSHA guidance. But OSHA standards and regulations are enforceable in Massachusetts. Now, it's worth distinguishing here between the types of information that OSHA can put out. There are standards and regulations that employers have to follow, but there's also guidance that is just strongly encouraged that employers follow. The most recent guidance from OSHA came out in June, so they're not mandatory except when OSHA otherwise states so. So the following information I'm about to provide you with are strong encouragements from OSHA. So OSHA's latest focus has been similar to the CDC in delineating between fully vaccinated and unvaccinated employees. For fully vaccinated employees, OSHA does not require that employers take any additional steps to protect them from COVID-19 unless those employees are otherwise at risk. Now, the exception to that is in certain settings, there are actual OSHA required standards, like the healthcare setting. There's an emergency temporary standard that requires employers to do more for employees under OSHA. We imagine that the majority of you sitting here are not employers in the healthcare context, however. So again, these guidelines that we're talking about from OSHA are just guidance. They're not required unless OSHA has specifically said so. Now, for unvaccinated employees, employers still need to comply with their general duty to protect their employees under OSHA. That is a regulation. All employers have a general duty to provide their workers with a safe and healthful workplace, free from recognized hazards that are causing or likely to cause death or serious physical harm. So practically, what can you do as an employer to protect your unvaccinated employees? Here are some things that OSHA encourages employers to do. You can allow employees to work remotely or have flexible schedules. You can enhance cleaning for high-touch surfaces. You can provide enhanced ventilation in your office spaces or workspaces. You can create administrative policies that encourage employees to get vaccinated or pay them for the time they need to take off of work to get vaccinated. You can provide face coverings and other PPE to your employees. You can require physical distancing. or supply perhaps transparent barriers where you cannot require that employees keep their distance. You can instruct all infected or symptomatic employees to stay home regardless of vaccination status. You can instruct non-vaccination employees to stay home if they've been in close contact with someone who has tested positive. Um, Another great piece of advice for all employers is to use multiple formats and mediums for communicating information about the spread of COVID-19, how to prevent it, and what your specific workplace policies are. Whether it's audio, it's visual, it's written down, it's in different languages, American Sign Language. You want to make sure this information is as accessible as possible and comprehensive as possible to as many employees as you can. In that same vein, it is incredibly helpful if you can tell your own employees that there will be no retaliation if they need to raise a health concern or report something going awry with one of the office policies. There will just be retaliation is not something they should fear, and you should have a designated contact person for any COVID-19 related concerns. Additionally, OSHA encourages that employers record and report work-related confirmed cases of COVID-19. There are other mandatory OSHA provisions explaining how to do that reporting that we won't get into detail here. But if you're curious, OSHA has a pretty comprehensive website, and of course, you can always reach out to us with additional and more specific questions. Now, OSHA also offers guidance for higher risk workplaces. OSHA provides a fact-specific inquiry for determining whether your workplace is a higher risk workplace. But things to consider are whether your employees are in close contact, whether there is a significant duration of contact, and what the type of contact is between unvaccinated employees or at-risk people, regardless of vaccinated status. Some examples of those types of high-risk workplaces might be manufacturing workplaces or workplaces with production or assembly lines. So OSHA offers the following guidance for those types of employers and workplaces. You can stagger breaks in employees' arrival and departure times. You can provide visual cues like markings on the floor or signs like many of us saw in the supermarkets over the course of the pandemic. You can implement strategies to improve ventilation. Once again, you can space out workers on assembly lines, or if you can't do that, you can provide barriers or transparent barriers, which again, we've seen kind of at any retail establishment. Finally, if your employees participate in any sort of ride sharing, if they carpool to work, it is recommended that you share with them and emphasize with them the risk of doing so, that you encourage them to spread out if they can, and to wear masks during their ride shares. And with that, there are more best practices even beyond OSHA, which Laura is going to talk a little bit about now.
Great, thank you. The first issue that we're going to talk about is that in light of the extreme sort of polarizing nature of some of the results of the pandemic, that employers should be particularly sensitive to and monitoring for conflicts among your employees, particularly if those conflicts have the potential to evolve into harassment and potentially unlawful harassment. As most people know from just simply listening to or reading the news, getting vaccination and wearing masks can be extraordinarily polarizing. There are two camps. One camp that says you should wear a mask and get vaccinated, or the other camp says that you shouldn't. You need to be sensitive to this in your employee environment. If you have an employee that is wearing a mask, other people might want to tease that employee or harangue that employee or make derisive comments to that employee. Similarly, if you have an employee that is not vaccinated, there might be a lot of pushback to that employee about their vaccination status. There might be comments about why this person isn't getting the vaccine, judgments that are being spread around the workplace. Those have the potential to fester and to become problematic. So I would encourage you all to discuss that with your managers and your supervisors, that they should be aware of that issue. They should be prepared to deal with it, to try to diffuse any conflict resulting from that. They should be prepared to consider any appropriate disciplinary action, and whether it should be reported up to HR. They should consider whether it is a violation of your harassment policy, and again, would need to be investigated. So do keep that in mind. It's always good to try to nip these disputes in the bud early on before they can blossom or fester into something more toxic. But it is something that we're seeing and we're hearing about in workplaces. So we encourage you all to be aware of that. The next question that I'm going to address is whether employers should mandate the vaccine. As we talked about earlier, you can. It's a different question as to whether you should. And again, when you're doing this, you want to keep in mind the reasonable accommodation issues that we discussed earlier for employees with disabilities or sincerely held religious beliefs. As Julianne indicated before, very few employers are actually mandating the vaccine other than those in healthcare or educational environments like schools. And I think recently the American Association of Pediatrics, for example, I think came out that even regardless of vaccination status, that you should be wearing a mask when everyone should be wearing a mask at school. So it will be interesting to see how that plays out. But in terms of vaccination and requiring it, consider the impact that it's going to have on employee morale, number one. You're going to have employees who consider that fairly invasive, that you are demanding that they get vaccines. It also will be an issue in terms of retaining and attracting talent. If you have someone who has a personal belief or indication that they don't want to get vaccinated, you don't want to dissuade that person from joining your company if you have a mandatory vaccine policy. Accordingly, most employers are not requiring vaccination, but incentivizing vaccination. And one of the biggest sort of carrots we've seen in incentivizing the vaccine is the fact that if you are fully vaccinated, according to the CDC guidance that Julianne discussed earlier, you need not wear a mask if that's the company policy, and you need not socially distance. That is a significant carrot and one that you should consider when potentially trying to incentivize your employees to get vaccinated. The next issue is whether you should require employees who are sick to get a negative COVID test before coming back to work. The simple answer here is if they are unvaccinated or their vaccination status is unknown to you and they are exhibiting classic COVID symptoms, which are include having a runny nose, having a fever, loss of sense of smell, loss of sense of taste, difficulty breathing. Yes, you should still require a negative COVID test for those individuals. The next issue is, well, what about the vaccinated people? 6 months ago, even at the start, when people were getting vaccines, the answer would have been yes. It's evolving over time. We live in Massachusetts, we are in Massachusetts, where a high population of folks are vaccinated. And at this point in time, that still holds true, although with the breakthrough infections that I alluded to earlier in Provincetown, it's unclear how much protection the vaccines are offering against the Delta variant. I am not a medical professional. I'm going to offer that disclaimer. But if a vaccinated person is demonstrating symptoms of some sort of respiratory or a runny nose, for example, you want to consider whether it's more likely that this person might have a cold or the flu rather than COVID. And that is more likely, in fact, that they do have the cold or flu, particularly since as social distancing guidance has been loosening up, people are coming into more contact with folks than they had before. And in the colds and the flus that were sitting quiet or fairly quiet for most of the pandemic are coming back in full force. So if you want to consider, whether you want that person to get a COVID test or not before coming back to work. Again, that is a decision up to the employers, but those are just some factors that you can consider and our recommendations. Next, I am going to turn it back to Julianne, who's going to talk about what to do with clients and guests who may be visiting your workplace.
Yes. So many of you might have clients and guests who pass through your workplace. And the question is, do we treat them the same or differently as employees? The answer is, it's up to you. The OSHA recommends, yet again, that you encourage guests and clients to wear masks to protect your unvaccinated workers. And again, that's because under OSHA, employees have a general duty to protect employees, and here it is unvaccinated employees. What you can also require that clients and guests wear masks, but if you're going to do so, it might be a good idea to provide them either at a reception desk or when they first walk in the door, so that way you don't have to turn any clients or guests away for not having a mask if they're not bringing one with them. Finally, another helpful tip is think about the way your workplace is laid out. Are there areas where employees go, but maybe clients and guests no longer need to go? Is your workplace one where perhaps before March of 2020, your clients and guests had free range of your space and could go anywhere? Can you restrict perhaps the areas where clients and guests are now permitted to go to limit the potential exposure from clients and guests to your employees? Just some additional helpful tips there. Another thing we wanted to circle back on is, once again, confidentiality. This is not only a best practice, but it is a legal requirement. So as Laura mentioned earlier, vaccination status is medical information. And that means as an employer, you have a responsibility to protect it and to keep it confidential. The Americans with Disabilities Act requires that an employee's medical information be kept confidential and completely separate from other personnel records. What does that mean practically? You could keep it in a locked file cabinet separate from other employee personnel files. You could keep it perhaps in a password protected database. But just as a reminder, their status, something as simple as whether or not they are vaccinated, counts as protected, confidential medical information that you need to treat the same way as other employee medical information.
And the last topic we're going to cover is just sort of flagging some issues for those of you who may have a unionized workplace. Just as I issued my disclaimer moments ago that I'm not a medical professional, neither Julianne or I are traditional labor lawyers either, but we just wanted to flag two concerns. First, for employers who are subject to a collective bargaining agreement, you may need to bargain to take measures such as mandating mask wearing in your workplaces or making other changes to the terms and conditions of employment to protect against COVID. That depends on what your collective bargaining agreement says, but we just wanted to flag that issue for you. The second issue is that Section 7 of the National Labor Relations Act protects employees who are engaged in concerted activities. The protection is originally sort of designed to permit employees to organize to see if they want to seek to form a union, but it's been interpreted very broadly to apply to any discussion that pertains to the terms and conditions of employment. And that concerns mask wearing, and that concerns whatever your vaccination policy is. So if your employees are getting together and complaining about having to wear a mask or complaining about the questions that you're asking about their vaccination and having those conversations among each other, that is perhaps and quite likely protected by the National Labor Relations Act. So again, please keep that in mind when moving forward in your workplaces. And I will now hand it back to Julianne.
So that pretty much concludes our program here today. To wrap up some key takeaways, the guidance is ever changing. So please continue to follow up with the CDC, the EEOC, and OSHA. Their websites are pretty user friendly, but if you have any questions beyond that, please feel free to reach out to us. Our contact information will appear at the end of this program. Also, another key takeaway is that the current guidance offers employers a fair amount of discretion, which is great. That means that you can really think about what's going to work best in your workplace and enact a policy specifically tailored for your workplace. But just please keep in mind that whatever policy you do put into place, that it is one that you can regularly and consistently enforce. That is when it has the most meaning for you and prevents future issues down the road. Finally, we hope to see you back here again. This is the 30-minute construction series. It is happening the third Thursday of every month. Next month in August, on August 19th, our session will cover residential construction risks. And if you like what you saw here today and want to share it with a friend or view it again, it will be available on our website, which again will be provided at the end of this program. So with that, thank you so much for joining us here this morning, and we hope to see you back here again soon.